Okay.
Thank you.
Okay. Good evening, everyone, and welcome to the January meeting of the AIHM Cleveland chapter. I'm Peter Geller, co-leader of this chapter, along with Dr. Amy Cipolla, who's right here as well, and Dr. Jacob Wolf, who is the outreach chair. And I don't know if Jacob is here yet, but he will be. So as all of you know, tonight we're presenting a multi-perspective panel discussion on integrative approaches to pediatric anxiety, a major and worsening health challenge for young people. And this panel is in keeping with our plan to follow solo presentations on the succeeding months with panel discussions on at least a similar topic. And so this panel is following an individual talk we had in November on the little recognized epidemic of pediatric long COVID. So our panelists are Dr. David W. Miller, MD, LAC, and Dr. Miller, who delivered the long COVID talk in November, is founding medical director for pediatric integrative medicine at Connor Whole Health and Rainbow Babies and Children's Hospital here in Cleveland. And he is one of the only physicians in the country to be dually board certified in pediatrics and traditional Chinese medicine. And we have Dr. Jody Skillicorn, DO, an integrative psychiatrist based in Hudson, Ohio. And she is the author of the book, Healing Depression Without Medication, A Psychiatrist's Guide to Balancing Mind, Body, and Soul. And finally, Dr. Colin Miller, ND, a naturopathic physician practicing in Cleveland Heights, Ohio. And in his pediatric work, we have two Dr. Millers, so I'm going to say this Dr. Miller specializes in pediatric acute onset neuropsychiatric syndrome, or PANS, and the related PANDAS syndrome, of which anxiety is a characteristic feature. So it would be easy for me to go on and on with each of these bio descriptions, but there's a lot to cover tonight. So for the sake of devoting as much time as possible to the topic at hand, I am going to refer you to the event listing on the AIHM website, which is aihm.org/events, if you'd like more detailed profiles of panel. So what we're going to do now is have each of our panel members give a 20-minute presentation on the issue from the vantage point of his or her own particular discipline and orientation. We're going to start with Dr. David Miller, and he's going to give us a general overview of the problem and why it may be worsening, implications for and impacts on the pediatric population, and so forth. And then he's going to proceed to speak from his dual perspectives of Western pediatric medicine and traditional Chinese medicine. And then we'll go on to Dr. Skillicorn and Dr. Colin Miller. And following the three presentations, we'll move to comments and discussion among the panelists. And I might get the ball rolling with a question or two that comes out of the presentations, but then we'll turn it over to the panel, and Dr. David Miller will moderate that discussion. And in the final 15 minutes or so, we're going to turn it over as usual to questions and comments from the audience. And so if you have something to say or ask, please put it into the chat, and Dr. Wolf will get to as many of those as we have time for. We're about to just start with this, but I just need to do one or two other quick housekeeping things. I would normally do these at the end, but I'm afraid we're going to run out of time at the end, and I just want to make sure we get these in. So first, I just want to let everybody know we are recording this, and it will be available soon on the AIHM YouTube channel. We'll send a note to everyone who's registered when that recording does become available, or you can just check on the channel. The other thing I wanted to say is that for anybody who is unfamiliar with our chapter, we do have a very active event calendar. Almost every month we do feature an expert speaker or a distinguished panel like this one that anyone with Zoom access can attend. So if you would like to participate in our growing regional IM community, or just simply keep apprised of these educational events, we invite you to join our mailing list and receive our monthly events and announcements newsletter. And I think Amy has put how to join our mailing list into the chat. There's a link there. All you got to do is click it, and there's like 2 things to fill out, and you're a member. Or alternatively, you can email me if you would like me to do it, and I'll add you to the list, petergeller.lac@gmail.com. And lastly, I just want to let you know, February, we are having an in-person networking event. We had a great one a few months ago. More details about that in the February newsletter. And the last thing I'm going to mention is that in March, we are going to be honored to host Dr. Paul Anderson, who is the renowned naturopathic oncologist. And he's going to give us the benefit of his 30 years in integrative oncology, and including much retrospective data analysis. And his talk is going to be reflections on common pillars of improved cancer outcomes. So anybody who's at all interested in integrative oncology, please join us then. And with that, I am going to stop speaking and turn it over to Dr. David Miller.
Oh, thank you, Peter. Thank you, Amy. I'm going to share screen here and go to the right view. Hopefully, there we go. Well, thank you, and thank you all for being here. We're so excited to be doing this. We have had a lot of fun planning it, and hope you'll find it useful. We really wanted to put together a program tonight that, talks about some of the theory of anxiety too, and approaches it from different viewpoints and different directions, but also gives you some practical take-home techniques, skills, things that you can use for yourself, your loved ones, or your patients, depending on your role and roles in life. And so we hope that'll be useful. And, we're not going to be able, obviously, to go over all aspects of all things in anxiety, because it's quite a big issue. But at the same time, I think we feel like there are some things that can be applied really quickly that may be immediately helpful. And so that's what we're hoping to do tonight. And so I picked this picture to start with some intentionality too, because one of the things I'm going to be talking about, Dr. Skillicorn, I think, is going to touch on too, is some of the inner dialogues and inner voices and the way we view things that plays a role in what's happening. When we think about anxiety in kids can present in lots of different ways. And so sometimes it can be kind of hard to figure out, what's going on with my child. Why are they irritable? Why do they seem depressed? Why are they not engaging in the activities that they would typically engage in? And so underlying all that, as part of the inquiry, we want to think of anxiety as a factor. And anxiety, we will probably all emphasize periodically throughout, is not anything abnormal, right? We all have anxiety. The goal is not zero anxiety. The goal is functional anxiety, motivational anxiety, and anxiety that really serves us rather than kind of paralyzes us. But it's interesting, of course, in kids that anxiety can present in many different ways, from behavioral issues to physical things. So somatization, the experiencing of emotion in the body, is super, super common in kids. And so things like stomach aches and headaches may actually be an emotional reaction underneath. And so keeping those ideas in mind. We also will make slides available to you too after this event, for review. So anxiety is a major issue in pediatrics. This estimate, this article from the Agency for Healthcare Research and Quality from 2017, there's always a lag time in the research in terms of the exact numbers and getting these, but this is approximately the same, or things have gotten a little bit more, was 1 in 8 kids. We've seen in the pandemic, and most estimates indicate that the problem has gotten bigger. Due to the stresses of the pandemic, the changes, especially in pediatric groups where schooling was disrupted, where all sorts of different types of changes occurred, and that uncertainty was there, which is always a big deal for kids. The National Institutes of Mental Health estimates a prevalence of about between 13 and 18 years of almost 25%. Sorry, I'm going to move my people here a little bit on the right. In a lifetime prevalence of 5.9, and we know anxiety, when it's unmanaged, can lead to further problems. It can be a precursor to depression, to substance use and abuse, to dropping out of school, to leaving activities that are beneficial, to all those things. And so it really needs to be addressed. Of the treatments available, there are things like psychotherapy and pharmacology. Usually a combined treatment strategy is something that we would advocate for. And I think what the other Dr. Miller is going to speak about tonight too, is some of the biological underpinnings of anxiety that may be able to be addressed by natural products as well. That's always one of those things that's harder to research, harder to get the money for research, harder to get the numbers of people for research, but oftentimes there's really good clinical experience behind it and very plausible biologic mechanisms by which we can, explore natural therapies for anxiety. And the wonderful thing about the natural therapies is they tend to have an outstanding safety profile. And so, it really is reasonable to try these things with young people because they tend to be safer than many of the things we might use in mainstream medicine in the first place. And so often a better first step in many cases. Cognitive behavioral therapy is probably the most evidence-based sort of strategy psychologically to work with kids, and we'll talk a little bit more about that just briefly. And then SSRIs are the number one sort of pharmacologic approach. And so along with CBT, what is cognitive behavioral therapy? The American Psychological Association gives us sort of a breakdown of that that's really nice. And overall, like not to read each of these bullet points, but overall, as you look at them, you'll see, one of the biggest problems with anxiety is how we think about what's going on. That fundamentally, in many ways, anxiety is a problem of perception and how we're interpreting our circumstances. Kids especially, remember, they don't have the background that adults have. And so they can't often put their experience into perspective. And so they tend to, have catastrophic thinking and, blow things massively out of proportion. I've had many conversations with kids where you're like, well, okay, so, you're worried that if you do this, then this is going to happen. Okay. And they're like, yes. And then like, well, what happens if that happens? So you fail the math test. What happens? And they're like, well, my mom will get mad. And you're like, okay. And so your mom gets mad for a little while, and then what happens? And then they're like, oh, well, I guess I could retake the test or do makeup work. And right. And so you work them through this thinking that's actually really basic, but at the same time, they haven't done it. So they get stuck at, I'm going to fail the test. And they don't really think about like, well, in the long run, though, kind of so what, right? So you'll try harder next time, you'll learn more, and everybody's going to forget about it anyway, and you're fine. So there are many, examples like that where you have to help kids put things into perspective. And we all have these patterns of distorted thinking that what I want to talk about is sort of the Chinese medical viewpoint on one of the Chinese medical viewpoints. Chinese medicine is an amalgam of viewpoints many times, but I'm going to talk about sort of a Taoist construct of this that I think is highly relevant and I've found very clinically useful. That really is also, I would root in a CBT kind of a strategy in terms of sort of the evidence base about why it may be useful. And so, just wanting to frame things that way. So to start with what I want to talk about what's called the 7-Po. And so in Chinese medicine, there's actually a very sophisticated and structured look at human consciousness and how we behave as creatures and what role different parts of our consciousness plays in our day-to-day activities. And so the Po spirits are said to be residing in the lung, which is part of the way the system classifies what they're doing, but it means they're very tightly tied to breathing patterns. And they're also very sort of animalistic. So I really think of this concept as sort of indwelling, instinctual, I think evolutionarily encoded sort of circuitry that helps to both keep us safe and keep us from getting into trouble and is very self-interested. It helps get us what we want, but at the same time can be very destructive when they get problematic. So the Po spirits are often shown in these two kind of forms where you have your sort of positive, very calm counselor form, and then you have these like torturous demons that come at us and really create a lot of psychic pain for people when they get out of hand. And so sorry, one thing there. And so what we think about with these two is that each of these different voices has a quality to it and has a domain of action. And so, no. There we go. And so we want to understand what they're saying and name them. And one of the advantages I think this system gives is a couple things is one, when you're working with this with patients, you can say, these are almost a multi-thousand-year-old concept. And so it underscores the normalcy of having these kind of internal dialogues going on. And so that people have identified these for, over 1,000 years, getting close to 2,000 years, depending on the source text. And so it bespeaks sort of a longevity of human experience. And I wanted to point to that through the Western literature too, that this concept of the inner voice is very much a part of Western psychology as well. And so this is more of like the Chinese reflection on that same human experience. And so again, sort of the evidence base of this lies in commonality of human experience. And then in modern times, there's different conceptualizations of this. But I think in the Western model, I seldom see it conceptualized almost as these sort of little spirits within us that we have to contend with. And the interesting thing about these constructs is that they are not thought to be really like external spirits. This is not sort of possession. This is anything in those realms, but rather different sort of sub-personalities that are in place to kind of keep us, alive and to protect us, as I said. They're considered sort of the somatic expressions of what they would say is the eternal soul, thereby indicating also that they're really us. So our eternal soul is our deepest sense of us. And so that actually powers these processes. They're said to be responsible for the physiologic processes in childhood and all of those. And so these are also seen as an important part of growth and development as a person. So I think I like to always frame these as well as sort of an opportunity for personality development. And we'll talk about that a little bit too. There's a separate part of the personality called the Hun, which has to manage the Po essentially, but we have to develop our Hun. So as children, we don't have those kind of higher brain functions, that sort of executive function, that self-reflection, what we might call metacognition, where we can step back and really consider things and make a choice that's good for everybody, right? So the Po are very self-interested, where the Hun is sort of socially interested and concerned with the well-being of everyone. So I would often say, like, if you put a piece of cake in the middle of a room of like kindergartners and say, okay, one piece of cake, there's going to be a pile of kindergartners on that piece of cake, and very few of them are going to say, well, geez, there's 10 of us and one piece of cake. Let's divide it up equally so each of us has the opportunity to enjoy it. That type of behavior is Hun behavior. The pouncing on the cake is Po behavior. I want that cake. If I don't go now, I'm not going to get any. Everybody else can kind of get pushed to the side. So we're trying to raise our children, we hope, to be a little bit more Hun oriented and to have that developed, cultivated personality. But we are actually dealing with these inner dialogues that we have to deal with sort of all the time to get there. So we see sort of that framework for the Po. So here's 4 of the 7 Po to introduce. And so these are some of the most common ones that I think we can all see in ourselves and certainly in children as well too. So one of the most common ones I see in kids is called fallen arrow. And it says that fallen arrow generates the foregone conclusion that attempting goals is fruitless. Why should I even try? I'll never make it. I'm too stupid to do math. I'm not good enough for the team. Nobody likes me. Why should I even bother? All these kinds of sort of self-defeating ways of thinking about things. And when you think about fallen arrow, you think about, well, what's the benefit of that? And I always say, like, so if you're standing on the edge of a cliff and you're saying, oh, I think I can fly, I think I would do great doing that. You want fallen arrow to pop in and go, no, you're going to fail. You're going to fall. You shouldn't do that. You should back away. And in that sense, fallen arrow protects us. But if you're sitting at the math test going, oh, I shouldn't even try, I'm just going to fail, well, then fallen arrow has turned against you, right? Or if you're like, why should I even try out for the school play? No one likes, I'm not going to be able to do it. I'm not good enough for that. Again, you've sort of taken yourself out of the game too soon, which serves as a protective mechanism in some ways. It prevents you from experiencing failure, you could argue, but at the same time, it really is sort of not serving us and overprotective. So we have to figure out ways to deal with that dialogue. Flying poison is one that many of us will experience as we drive, and that person gets on the highway and cuts us off and then drives slowly, right? Or wants to pass and then gets in front and slows down. We see road rage in this, that sudden explosion of rage, thoughts of evil intention. And you see this in kids all the time too, like, he touched my toy, and then, everybody freaks out, and we see flying poison emerge. Unclean evil or shame is sort of a voice that maybe you could think of it as almost at the root of sort of addictive behavior, sort of sneaky behavior, going off and doing things that are wrong, and you sort of talk yourself in or out of them, and then doing these things, then feeling terrible and having low self-esteem from them. And then yin bird or night tormentor, it says, harasses the individual, causing him or her to experience extreme pain and severe anguish, particularly in dark places and at night, and nightmares and restless sleep. And so, the kids who are afraid of the dark or afraid of the unknown oftentimes can be one way of thinking about it. And so from sort of an evolutionary perspective, I would say with Yinbird, for example, if you're a night creature like a mouse who's a nocturnal feeder, you're going to, leave your little nest to go out to look for food. But if you're not aware that there's an owl out there that will eat you given the opportunity, you're not going to take appropriate cautions, and you're likely to get eaten by the owl and die. But if you stay in your hole and you're so afraid of the owl that you don't leave your hole because, you're too afraid, then you're going to starve, right? So you need sort of a happy medium of these where they give you enough worry and enough caution that you take appropriate, preventative measures, but not so much so that you end up harming yourself through that, consideration. And so these are sort of 4 flavors of these internal dialogues that we may encounter. So when we talk about the Hun, that's that aspect of us that we're trying to develop. They divide the Hun up into 3. We're not going to go a whole lot into the Hun, but just to know, as we work with kids and as we work with adults, to help them, manage these dialogues and see bigger pictures and understand more context and really think from that place of sort of communal benefit, we're nurturing actually a very specific part of the personality that is considered sort of very valuable and kind of who we want to become when we grow up at whatever point in our lives that ends up happening. And so the Hun and the Po stand sort of in contrast to one another, but the Hun are not developed in childhood. They start to develop as we get older, into later childhood and adulthood. But it is a process of fostering that development. So when we manage the Po, how do we manage these? Because they're said to reside in the lungs, they respond strongly to breathing. And so when a kid approaches you and they're like, I'm never going to be able to do this. I can't. I'm afraid to go. I can't do this thing. So the first thing you do with them is let's take some deep breaths. Teach them that diaphragmatic breathing, belly breathing, help them calm down, help them get a little bit of perspective, and then work with them to identify like what's that dialogue you're having in your head, and a lot of times, almost most times, kids can identify it. They might be a little embarrassed too, and you can give them little options and examples of kind of what you're thinking. But if you're thinking like you thinking you just can't do it because you're going to fail, and you're worried about that too, then you say, oh, that's called fallen arrow in Chinese medicine, and that's been around for over 1,000 years. This idea is so that's really, really normal for you to be feeling that way, and we all feel that way, and we all have that voice we have to deal with. Because remember, kids and oftentimes adults don't know that they have that. I had an adult patient who was struggling with some eating issues, and we talked about sort of the unclean, evil, shame idea too. And she's like, I thought I was the only one who struggled with these things. I mean, even as an adult, she was thinking she was the only one who struggled. And so that normalization process is really important because it decharges kind of the situation. It takes away some of that stigma, some of that self-questioning that can really hold someone back from moving to the next step. So then even take another deep breath too. And then your goal is to try to put that voice into perspective. So they call that finding the counter mantra. And so, it's usually not something like if the kid says, I'm going to fail the math test, I'm no good at math. You don't say to them, no, you're great at math, you're going to do super, right? Because that's probably not true. It may not be true. Some of the kids it probably is, but most of the time the exact opposite is not helpful. So what you really want to do is sort of tease that out and say, okay, well, why don't we think of it this way? Just do your best. And if you fail the math test, it's fine, right? You'll do some makeup work, you'll try again. But if you never try, you're not going to succeed. So let's have an attitude of sort of try again. And if that works for the person, then there's your counter mantra. And then you teach them to recognize the voice, identify they need the counter mantra, and you're creating that separation also of sort of themselves from the dialogue. Because especially in kids, but I think often in adults too, we think that dialogue is us. We think that that is our higher self. We think that's absolute truth. And in reality, it's sort of a brain region that exists in everybody that's, probably fairly primitive. And if we can use what's called that metacognition, where you can step back from your thoughts for a minute and kind of look at them from a little bit of a detached standpoint, you can gain that view of like, wow, there I go again. And oftentimes, like, fallen arrow, for example, will change in permutation. Like it'll find different targets of things you're afraid of failing at, right? But it's all fallen arrow. And you can do things with kids, especially too, like have them draw a picture of fallen arrow, have them draw, make music around it, do something like that that really sort of separates it and encapsulates it and creates that space. And that often is just really helpful from right there. And so, help them understand how, okay, well, I know you're afraid of failing and you don't want to disappoint this person, but in actuality, you're going to have more success if you go this direction. So again, that perspective setting is really an important component of management, building that metacognition. And that's really sort of the practice with managing these voices. It's a lot of insight building, a lot of separation, that metacognition, but know that you're also really helping someone with a lifelong process, because these voices don't go away throughout the lifespan. And what we also see with these types of voices, that I think probably some of the other panelists may discuss too, is that there are events that can trigger them, right? Maybe somebody has a really bad experience where, I'll stick with the math test, they fail the math test and someone makes terrible fun of them and they make them feel really bad about it, right? So that then primes this dialogue and it gives it justification. So you're also looking for things like, where did the priming of that dialogue begin? If we can sort of find that time when that got turned on, we can think of it almost like as an epigenetic switch that got flipped, that turned that circuitry on, that stress circuitry. That often can also help to diffuse it. But sometimes you don't know. I was working with a very cute little kid who was, having some, potty anxiety and was crying going to the bathroom the other day, and he didn't remember why he was crying when he went to the bathroom, right? Something happened when he was probably 1.5 years old. When he was little, I always like to say that with the kids. When you were little, you probably had something happen. And now you're big because you're almost 4. And so, that often works for them. They're like, okay, and they can kind of get some distance from that. But there's often priming events and things in the world that trigger these things, that get those voices into action. So that's the vision or the view I wanted to present. So the goal is never to be 100% anxiety free, but rather to functional and motivational anxiety, keep those inner dialogues under control. They can challenge us to evolve our best selves. Life is messy and we want to enjoy the dirt a little bit too. So finding the right perspective on our issues is often the key to keeping our anxiety healthy. And so with that, I'd like to pass it to Dr. Skillicorn to do that. I will give you the share there. And yeah.
Thank you, David.
There we go. Sorry about that. So yeah, so I'm gonna be piggybacking on a lot of actually what David said, and I love I love the images are so wonderful because it's a great depiction of what goes on in the head with anxiety. So I just want to take a moment though to kind of transition from that talk to mine, and just take a mindful pause. So just looking at the image here and just listening to the sounds. And just noticing your breath in this moment. And so what we know from research is that actually just doing that, just connecting with nature, and it doesn't even have to be outside, just looking at nature, listening to nature actually helps to calm the nervous system and calm anxiety. So it's just a simple thing people of all ages can do, and have pictures around or music. So anyway, just starting there. But just notice how your body, even in this moment, just looking at this screen, responds as you shift from the last one, right? And these kind of images are what kids are absorbing for hours a day often. My daughter, she has a 15-minute self-imposed limit on her TikTok, but she gave me a little tour this weekend. And these were the images we saw within just a few minutes of scanning through. And so I look at this and I think, well, how are kids not anxious? And I'm talking more teenagers. I mostly see teenagers, so I won't be talking as much about the little kids, but kids very young are seeing this stuff too. And I could feel my nervous system ramping up just looking at this stuff. But yet these images, these stories, these are what are these headlines, these are what I think are a huge part of the anxiety surge. And it just fuels the fire. And obviously there's many causes for anxiety. I mean, but ultimately we live in a world that feels very scary right now and very threatening. And kids and adults are being inundated with these messages of fear and doom and despair. And then you add in poor diets and less exercise and less sleep and more doing and more busyness and busier schedules and more staring at electronic devices and not getting outside. And I mean, it's shocking that actually their numbers aren't actually higher than they are. And then you add in climate change and the very real threat of mass destruction of the planet and changing temperatures that we see and can feel, and drastic weather events that we're seeing on the news and on our social feeds. And so I think it's just important to, and David did a good job of this already, like anxiety is unavoidable. It's part of the world we live in. It's part of the air we breathe. And it's going to be even larger in times of great transition, which is where we are. And so I think, right, the difference between everyday sort of angst and more problematic anxiety is just a matter of degree, really. And that is largely, as David pointed out, largely determined by the stories we're telling, the way we're perceiving these stressors. And those are largely determined by our early life experiences. So I just want to briefly touch in because climate anxiety is so huge, but right, they found that worldwide searches for climate anxiety have increased by 4,590% in just the past 5 years. That's crazy. And a Lancet study of kids around the world shows that the majority of these kids are moderately to severely worried about their futures, about how this will impact them, and they're feeling hurt and angry and betrayed by the adults, us, not being able to protect them, by their government, not being able to protect them. And so again, like this is all there. And so I think the question isn't how do we, as David said, how do we get rid of anxiety, but rather, how do we learn to be okay with not being okay? How do we learn to be okay with being uncomfortable? How do we learn to be okay with having stories in our heads that are partially true, but not entirely true? So I think that's the big challenge. And so we all know what anxiety is. I don't need to tell you this, but what I do want to point out in this slide is when you look at the physical symptoms are no different than excitement. And so again, it's this perspective. And there was a really interesting study done by Harvard, an MRI study, where they looked at they looked at physiological responses, but they made one change between two groups. In the one group, the people were I am anxious, and in the second group, they just shifted it to I am excited, and that instantly shifted the experience from a threat mindset to an opportunity one. And so, even though the same symptoms were happening, there wasn't that stress response. There wasn't the spike of cortisol and the stress hormones. It was a much different response, both physiologically in the brain and also just how it was felt. And another important reframe that I do with my patients, even when they're talking about it, I will encourage them to kind of shift it from I am anxious to there is anxiety, right? Emotions move through us. And so I try to say, whatever the emotion is, there is anxiety, there is sadness, there is anger, there is frustration, but it's something it's not us. It's something that's moving through. And I think just that reframe creates a little space so that it can move through, because it's our thoughts that kind of get it stuck in our bodies. So as I mentioned in earlier, right, the difference between problematic and just regular anxiety is a matter of degree. And again, we're talking about stories. So in the early, like most of these stories are set in place in the first few years of life, really before 3, mostly before 7 for sure. And basically it comes down to, right, if a child's lucky and it lives in a safe environment and has parents that can help co-regulate, right, this primes the ventral vagal nerve, which allows us to connect with others, to feel trusting, to engage in life, and to sense that when we do that, we're basically safe and supported. Not that bad things can't happen, but that we're essentially okay. But when that doesn't happen, when the things on this list, right, the more of these that happen, the more likely there is to be all kinds of what we call mental health problems. But really, they're just a response to how the nervous system is forming. It's forming in a way that thinks that sees the world, even neutral environments, neutral facial expressions, neutral tones of voices as threats, based on these experiences. And as you can see, the odds of anxiety and depression drastically increase if you've had 4 or more of these. And you can also see from this list, right, it's so important to ask about these kinds of traumas to get a sense of where these anxieties might be coming from. But some of these traumas, when you look at this list, we're finding more and more, they wouldn't even know they happened, right? So there's intergenerational trauma, there's perinatal trauma, right? And that gets imprinted in the child's autonomic nervous system. And then there's collective trauma. Again, climate crisis, mass shootings, political polarization, all of these things are shifting our nervous systems. And so really the work then is to learn how to regulate our nervous systems more, at least as best we can. So again, we all know dysregulated nervous system leads to inflammation, which leads to all kinds of problems, pretty much any chronic disease you can think of, gut dysfunction, impaired immunity, damage to the brain itself. But the good news is, right, is these things can be shifted back as the nervous system gets re-regulated and more balanced, right? The body can start to reverse this pattern. So there's tons of ways to obviously regulate the nervous system. And obviously not going to go through all of these, but just the bottom line is just they all are working to mindfully work with the body and the mind and become more aware and slow down and be present. So David already mentioned this briefly, but the one I primarily focus on with everyone, no matter what, is breathing, because every anxious kid, adult who walks in who's anxious is breathing short, shallow breaths in the chest. And that basically, what I tell people is, right, that's basically sending a signal to the brain 24/7 that something's wrong. And then our brains are really good at figuring out what that something is, just the many pose, right? Like, we will find, there are a lot, if we're looking for something to be wrong, we will definitely find it. So I tell people that, and then we just work with, breathing into the belly. And, with kids, you can just put a teddy bear on them, or there's so many ways to do this, and there's tons of videos and tons of apps. So I'm not gonna teach this, but what I like just tell them is, right, so once you breathe into the belly, right, then we sends a signal up to the brain, letting the brain know that right now, right, we're safe. And we don't know what's going to happen next, but in this moment, we're okay. And what research shows is 20 minutes of breathing for a period of 6 to 8 weeks can fundamentally shift the nervous system, change the structure and function of the brain so that it's less reactive. And so that's really getting to the root of those early adverse childhood events. Yeah, I'm not going to do this. And so breathing is just one of many of the mindfulness tools. And mindfulness really is just a big umbrella term. But 2 of the key things that it's doing is they're all are going to bring us back to the present. So even right now, noticing your feet on the ground, noticing your back against your chair, noticing the feel of the air on your skin, the light of the room. Because if we can bring ourselves back to the present, right, it's essentially an antidote to anxiety, which is always the future. It's always worrying about what's going to happen next and catastrophizing and imagining the worst case scenario. And so mindfulness brings us back here. And then it also allows us to become more aware of the the interpose, the different stories that are going on inside our heads and the different triggers and the different emotions, and start to even know where the emotions are in our body so that we can directly work with them there and not just always in the mind. And so I kind of went over some of this, but again, key components, noticing that thoughts are stories, not facts. So again, pretty much, and starting to really, so much of anxiety is fear of the body. So really starting to notice body sensations with curiosity rather than as a threat, right? And really, right, a racing heart does not mean something's wrong. It just, if we can just be curious about it, it shifts it. And again, back to the naming, which we talked about earlier, and then just grounding in the present. And then another key part of mindfulness is self-compassion, right? So many of anxious thoughts are about the shame, or one of the posts was all about shame, but right, the self-judgment for being anxious, it just becomes this perpetual cycle to feel anxious about being anxious, and then to blame oneself for feeling anxious, and then to get mad at oneself for blaming oneself, and it just goes around and around and around. And that just further activates the nervous system. So compassion with people, even when we're just talking, I will often have them just sort of rub their chest, right? Just to ground themselves. But that simple act offers them some compassion and some regulation, but it even causes the release of oxytocin, which allows them to have that sense of connection and a sense of safety. Or another one I like to do is just tapping, or just holding, or even holding kind of under the armpit, and just really offering ourselves the support that maybe that others may not be able to give us or didn't give us when they were little, or just imagining someone offering us that, someone that's very caring and loving, imagining that, and that alone can shift the nervous system and decrease the release of cortisol and increase the heart rate variability. So I'm not sure where I am in time, but I'm going to kind of go through moving. We all know, but moving is super important, just to release stress. We all know this. We've all experienced this. So if you can get outside, even better, but it has tremendous benefits for calming the nervous system. And this is one that is really good for kids. This is what I used to do with my kids all the time. I love this. But it's just moving your body. But shaking is actually one of the oldest forms of mindful movement, going back 100,000 years. And so there's different variations for obviously older kids, just shaking more of Qigong style, but moving the body so that we can release those chemicals from the body. So if you see National Geographic specials and the gazelle runs away, the gazelle will just shiver and shake and release all that stuff and then come back to the present. Shake. Repeat. And then, of course, getting outside, right? So 15 minutes outside and in nature improves mood and decreases stress. And yet, fewer than 10% of teenagers are getting outside daily. And I suspect that's the same for even younger kids. More and more kids are indoors, just looking at the messages and their phones and their TVs and computers and whatnot. So, so this is for real. So if you can't get outside and you're stuck inside, so again, you can look, like I said earlier, you can look at pictures, you can listen to nature. But apparently one person actually did a study where even just watching cat videos, and I'm sure it's not just cat, any animal video, decreases stress. So I'm just going to give you one quick sliver of apparently a very famous feline on the web. So just notice your nervous system. So that is Maru, and she has 100 million views. She's very famous. But, and then I just want to circle back just quickly to eco-anxiety. So all the same, regulation is obviously just as important in that way. I think the other important thing is just to move away from binaries, and I think that's important for anxiety in general, but moving away from good versus bad, into more paradoxical thinking, right? So yes, things may be bad and climate change is happening and collapse may be inevitable, and there's lots of good in the world, and it's not all happening right this minute, and there's lots of caring people doing their part to change things, and actions matter. And for eco-anxiety in particular, action really does matter. It's been shown to be the most powerful way to help kids not feel, and adults not feel so helpless and despairing, to actually get involved in collective action in particular, as well as individual action. And just a reference there, Climate Psychology Alliance has a lot of free programs for kids and adults of all ages. David already covered, obviously CBT is gold standard, although my favorites are mindfulness-based stress reduction and mindfulness-based cognitive therapy, because they sort of mix a lot more of these mindful tools into the mix. Lots of resources, lots of apps, lots of online classes. And again, I just want to finish with a final reframe, right? Can we see anxiety more as an adventure that can lead to growth and resilience rather than a problem, as David mentioned too, to be fixed and vanquished, right? What we resist persists. So can we just be in anxiety and not distract or run or fight from it, but learn to kind of stay in it and realize it's okay to be anxious? And that is it for me.
Great. Yeah, we can have you stop share, or Colin, you can grab the share and
Okay, excellent.
pop that on.
Um, oh, there it goes. Did it go?
Yeah, he got the share. So that's
Great. Well, thank you so much, Jody and David, for this incredible presentations. And I will just piggyback off that.
sorry, Colin, but are you there? You go. Perfect. Never mind. Thanks.
So what I'm going to start with is discussing more of the biochemical causes that may be also in play in anxiety. Because what I'm seeing is all these exercises are absolutely fantastic, and we do them in the office all the time to help deal with the presence of anxiety. But sometimes I find myself even today talking with parents of kids I work with, it's not necessarily this child's fault what they're going through, because they may be experiencing something within their body that is so overwhelming that they might need to scream, they might need to shout. We have kids throwing things, destroying things. Obviously, it's not conducive to learning. It's really difficult to be in school. But point being is, it's not like anyone's blaming them when I use the word fault, but really just to understand that there might be these underlying biochemical causes, and that's what I'm going to discuss. So we use the term biochemically induced anxiety to talk about that. I'm just going to shift this. Okay. So what I try to do is really see if any of that is at play when I have pediatric patients presenting with anxiety. And there's a couple main categories that we can look at. And I wanted to talk in the first part of this discussion about how important that is, and when we take the history with our patients, just to see if any of these are at play. So we look at things such as food and environmental allergies, as well as heavy metals. And basically, in general, if we have these types of things going on, it activates the immune system, which is really what an allergic response is. And I'm going to talk a little bit about why that's important. And that comes from a field called psychoneuroimmunology that's been around since the 70s. But basically just understanding that there are sometimes different immunological factors that are basically circulating either within our body in the periphery or produced in the neuro-CNS, the neuroimmune system, that can actually cause us to feel emotions and to cause psychological behaviors and physical behaviors. So basically things like food allergies can cause that, environmental allergies, and without getting into all the nitty-gritties that we a lot of us know about, there are things like IgE, mast cell activation, release of histamine when that circulates the brain, as well as different cytokines. And so there's actually been quite a bit of research published on specific factors like TNF alpha, interferon gamma, and different ILs 1, 6, and so forth, that have been shown to induce different types of emotions. And this is something that really got me interested when I learned about that from one of my mentors, Dr. Zwicky. And I think that it helps sometimes people to know, like, hey, for example, this came from when we get sick, for example, and these are released. Some of these are what makes us have a fever and makes us have a feeling of malaise. But they also can make us feel feelings like anger, anxiety, depression. And we've kind of been able to associate some of these feelings just with different studies about that. And then there's also the autoimmune response, which really comes about when the body is perturbed over time with these types of immune activations. And I'll talk about that a little bit down the road. So just to piggyback off of what Jody was talking about, the psychosocial stressors release peripheral CRH, and that's been shown to increase gut permeability, and also the increased sympathetic tone of those stressful experiences, decrease gut motility, decrease production of HCl in the stomach, bile production, digestive hormones and enzymes, all the things that make a proper digestion. And what I'm going to talk about for most of this presentation is the microbiome, the gut-brain axis. It also, we've seen that when norepinephrine is released, which is with the sympathetic response, that there's increased bacterial translocation across the gut mucosa, as well as different pathogenic bacteria is actually promoted to improve their survival. So that same type of thing would happen with, for example, like decreased ACL production, which our beneficial bacteria favors a more acidic environment for growth. So basically, then what's been shown directly to be implicated with anxiety are these pro-inflammatory cytokines, as I mentioned, IL-6, TNF alpha, IL-1 beta, and IL-2. And then we've also seen that the anti-inflammatory factors such as IL-4, IL-10, and so forth have anxiolytic action. So they actually have been shown to decrease anxiety. And in the regions of the brain where we see, where we can control some of the impulses that come about with anxiety, the prefrontal cortex, for example, have been shown to be involved in these processes. So with that being said, what I wanted to talk about for the rest of the discussion is the microbiome and why that's so important. As a lot of us know, it's becoming more and more in the forefront of understanding about our health. And there's a couple important factors, for example, metabolomes, quorum sensing, which is how the bacteria kind of have a parliamentary procedure, voting procedure to decide about the communities that are living in our microbiome. And then if we see that our microbiome is not thriving, we get more gut inflammation, which of course causes an immune response. Inflammation is an immune response. And then of course, those cytokines will be circulating up to the brain and causing those emotional reactions. When the gut is more permeable, we also then can let different metabolites and factors that go into the bloodstream, which then cause an immune response and oftentimes eventually an autoimmune response. So that has to do with that mucosal immune function. Intestinal motility is shown to be related to a healthy microbiome. If our food isn't moving through our gut, well, it can sit there, it can ferment. We get things like constipation and so forth. And also very importantly is nutrient absorption, because if we're not absorbing nutrients correctly, then we may not even be able to make sufficient amount of neurotransmitters that give us a nice, healthy mental status. So let's see here. Okay. Yeah, so the microbiota gut-brain axis is bidirectional. It's really our innate host defense system. 70 to 80% of our immune cells live in the gut. There are a lot of cells. There's 10 to 100 trillion cells of these different types of friends that we have living inside of us. Really, we have a symbiotic relationship with our microbiome. It is imperative for healthy digestion, all the factors that I had mentioned before, as well as synthesizing hormones and vitamins, and important for metabolizing drugs, removing toxins, communicating with the CNS through the vagus nerve, which I'll talk about in a moment, different gene activation, and immune response, as we touched on. So this page just kind of goes into more detail, and you're welcome to look at it another time, but just talking about the increased immune response, autoimmunity, having good neighbors in our gut, and some of the more details about what happens in this stress responses, and which can come from psychosocial stressors, or things like food allergies, environmental allergies, and so forth. As Hippocrates said, it is more important to know what sort of person is a disease than to know what sort of disease a person has. And so this really is where we get into the idea of terrain, and the idea that our microbiome is a really wonderful example of that terrain of our body, meaning who we are and what we have as our consortium of microbiome is how we actually can defend ourselves against any sort of microorganisms that we're exposed to, any sort of toxins, and so forth. So what I really look for, and it's really important when I work with my pediatric patients, is talking with the parents and mom about how their first days and years of life were. And so we talk about things like vaginal versus C-section birth. I just want to make a point too that I'm very careful to never place any sort of blame or any feelings of inadequacy or wrongdoing with the parents. Like, this is not saying anything about their fault, but this is just what happened, and we just try to say, hey, this is what is possible, is involved in why your child is having these issues. So we do talk about that in a very gentle, respectful way. And if we think about it, having a vaginal birth is really important in the sense that as babies, we don't have immune systems fully developed till actually about 3 to 14 months. And then there's a transitional time, and then it's not really fully developed until a few years, actually. There's different data, but these kind of values shift. But the important thing about that is we get important from mom's vaginal canal. And also we talk about breastfeeding. And again, breastfeeding is ideal if possible. If mom can't produce milk, that's obviously we're going to be using formula. Maybe there are times where there's a reason in the child's health, where they have to be in the NICU for months on end, and they are formula fed. So we just look at all the circumstances and just determine, if this may be a factor. But basically, mom will provide the microbiome factors for a healthy microbiome through breast milk, as well as IgA immune defenses, which is really important. So as some of us know, the IgA is important for mucosal immunity, and the gut is mostly lined with mucosa and the glycome, of course. So then we also see that the microbiome is important for development of the brain, and especially in areas like the prefrontal cortex, where we know that's where our top-down control of anxiety happens, in terms of the amygdala and the basal ganglia and so forth, and other limbic system areas that can control those areas. It's also important for the pruning neurons of the developing brain. So we see that in some autism spectrum disorders and so forth, where actually the brain may have overdeveloped in certain areas, and we see more white matter growth in other children. As mentioned, the microbiome enables hormones and neurotransmitters. There's just really interesting stuff. I definitely, if you'd like to look at the bibliography, there's a lot of articles. I find this stuff fascinating, that our microbiome actually creates some hormones, and definitely certain vitamins like vitamin K and B vitamins that we can't make, actually, and we depend on them. Also, of course, as we talked about, absorption of nutrients, the building blocks for neurotransmitters. Then we talk a bit about our diet. I like to talk about the diet. A lot of times we see with kids with some conditions, they really, I mean, obviously a lot of kids are very particular about their foods and they don't, you know, they want to eat their macaroni and cheese and pizza. If we're really just eating a lot of processed foods, that's going to really have an effect on our microbiome. It really depends on a healthy fiber content, you know, a good mix of fruits and vegetables, and healthy, you know, fats and carbohydrates. So the diet is actually really important. And there's been a lot of studies done on, you know, this country, but also countries that then adopt diets like ours and what kind of happens over time to the children. You know, for example, there was a study in China that showed, you know, over, you know, in the past however many years since the diet was adopted more, eating that NAF, you know, NAFLD, non-alcoholic fatty liver disease increased quite a bit, and just like obesity in general and diabetes, childhood diabetes. So then just to touch on some of the children I work with have PANDAS or PANS, which is a neuropsychiatric autoimmune response, a neuroinflammatory response, either from a strep infection or other different types of infections. And anxiety is often a really big part of these children's life. And so I really take the time to explain to the parents a lot about what I talked about today, just to say, hey, you know, this is what, you know, your child is experiencing. You know, sometimes when we have these cytokines floating around, it can cause us to feel these types of experiences. So hopefully if we can get these infections under control, that actually their symptoms of anxiety and OCD and ADHD and so forth will decrease. And so a lot of times that's how I track the progress with the children in between, you know, taking the titers and so forth to see their infection levels, is just to see, hey, how are they experiencing their life? How are they interacting with other kids at school? You know, are they able to go to school? And so we do talk a lot about these topics. And then just to finish up here, there's a lot of research out there on terms of what types of probiotics are useful to, especially related to anxiety. And so lactobacillus, bifidobacterium, and more recently we've been going into other strains such as Akkermansia and various other strains. So there's a lot of great products out there that practitioners can use, but of course I won't go into details to promote any brands. So thank you very much for the time, and I'll hand it over to Peter.
Thank you so much, everybody. Those were three like amazing presentations. There's so much there. I wish you each had 45 minutes instead of 20. It was really cool. But to just get the ball rolling with discussion, there's a couple of thoughts that occurred to me that you may like to comment on, or David, you could otherwise just take charge of it. But two things came to my mind. Jody, when you were talking about having kids say there is anxiety instead of I am anxious or like that, you know, the way it hit my ear, there is anxiety sounds like a kind of dissociation though. Isn't it important for them to like say, I feel anxious or I feel some anxiety? Because then they're feeling it, but they're not necessarily identifying with it. So I just wonder what you think about that.
I mean, yeah, well, one, they're feeling it, and as I'm doing it, I'm having them very much drop into their bodies. But the idea is really emotions, they do pass through, right? It's like a sound, it's like a smell, and it's just kind of understanding that this is coming, and yes, we have to acknowledge it and feel it in the moment, but we don't have to get stuck there.
Right.
And so, and some languages do, that's how they use the language. And that's actually where I got the idea. That is the way the language is spoken. And it isn't even it true in Chinese that like the idea is it's almost like another sense, just like smell and sight. Maybe that's not true, but that's what I've read somewhere.
Well,
Yeah.
in Chinese medicine, the emotions are all supposed to be able to be felt and passed through, as you say. Like, it's not healthy to not be able to feel a particular emotion, and it's not healthy to be stuck in a particular emotion. They just come and rise through and pass. That's the healthy
Yeah. So I guess
attitude,
that's
right?
there it is, it's passing through versus
Yeah.
I am
Okay.
that.
It's just,
Yeah.
it's just how it struck my ear.
Yeah.
It just sounded like a little dissociative. But no, I hear your response. It sounds good. And my other second thought was, I was just like fascinated to hear, Colin, you talk about the induction of specific emotions through the immune system, like cytokines and stuff. I was never aware of that. I was always thinking in terms of, well, sure, there's inflammation that's creating malaise, that's creating irritability, it's this and that, but I never was aware of like specific elements of it creating specific emotions, and that's been demonstrated.
Yeah, it's really fascinating. I agree, Peter. Yeah, because we talk about it just like evolutionarily, and like there are benefits to having these emotions, and that's why we have them. For example, if someone is is sick and they're infectious, if they feel like being alone and they feel tired and so forth, then they're going to go on by themselves and be less likely to infect others. So there are benefits to these. I think what happens is just when there's a lot, when it becomes chronic, or like when it's hanging around a long time, or we have a very high level of these, like some sort of infection that's really high, viral load and so forth, then it really becomes overwhelming. And yeah, it's really interesting because the blood-brain barrier obviously is really trying hard not to let these types of things pass through. And so there's just certain parts of the brain that are actually just more exposed to the bloodstream, and those tend to pick up these responses. But actually, most recently, there was a paper published that found even if the infection just stays peripherally, that there is this neuroinflammatory and neuroimmune response that takes place. And they studied like IL-17 and found that those levels increased even when there is just an infection peripherally. So there's a lot we're learning about that. And yeah, some studies have done literally like, I think like IL-1 was anger, and IL-6 was depression. And I think that, really what they did was probably take a survey, they took surveys with different people and tried to, kind of pinpoint these emotions. So, yeah.
Thank you. David, back to you.
Oh, thanks. Yeah, no, thank you guys for a great conversation. I mean, lots of ideas in there, and I hope people will take the slides and sort of sit and think with them, because a lot of, we want a lot of practical stuff as well as some of really diverse kind of theory look at things too. And so I was thinking, Jody, for your presentation, I was wondering if you thought about or had commentary on the idea of sort of reimagining a situation. It's very much in the vein of reframing. But I was sort of taught also too, like the brain doesn't always care what actually happened or was actually real. So I was wondering if you could speak to that as well.
No, I mean, that's as far as I do that almost every day with people. So I do a lot of EMDR, and when I do EMDR virtually, I do this butterfly hug, but a lot of it is just that. It's so you imagine that thing, that trauma, and as you're imagining it with somebody who could be there and support you in the way that didn't really happen, right? Or imagining even an animal there with you at the time, and then what does that little you need, right? And then offering that and envisioning it in detail, right? Imagining, often the little kid wants to go play, and just imagining that, but with somebody who can help co-regulate. So whether that's, sometimes it's a deceased loved one, or a loved one, or an animal. It's often an animal. It's just so unconditional, and just imagining that with
That's
and so
great.
that's very, very important and powerful. Yeah.
Yeah, that's a great, and I think that can be pretty easily incorporated, I think, by people too, helping them reimagine outcome. And I love the idea of bringing in a comforting presence, whether it be, alive or not, animal or human, whatever works, and allowing the
Real or
mind to do that.
imaginary. Yeah.
Right.
Yeah.
Cool. And then great. Thank you. And Colin, I always think of like histamine as sort of an alarm signaler, right? Like histamine is like you are being attacked. We need to mobilize resources. And I think there's a central nervous system aspect to histamine that's very much like that behaviorally and accounts for some of the the anxious responses. And I've seen kids where really the key to their anxiety modulation is via histamine, not by serotonin. And I'm just wondering if you had thoughts on that and what some of your favorite ways of maybe modulating histamine by, naturally were.
Yeah, awesome, great. Yeah, that's so interesting. Yeah, histamine really can cause that response. I've noticed that as well. And so for me, it's really finding out if there is some allergy situation going on, because if there is a mast cell activation, those are obviously the cells in our body that release the most histamine. And so in that case, what I do is I try to find out, through I usually either lab work or just also asking, hey, when you eat this, what happens? Or if you were to eat anything you want, what would happen? That's usually the best question, because they might have already cut something out of their diet because it makes them, their tongue feel tingly. Or, but yeah, so really just usually taking the food out of the diet, at least for a moment, is what is the best way for me to do it. And then what I look at too is the idea of gut permeability, because what happens that I've noticed, for example, is, let's say we do an IgG lab and we find some elevated IgG for certain types of foods, and we take those out of the diet, but maybe a couple months later they're having reactions. Now, like let's say we found strawberries, and then all of a sudden they take that out, but now they're finding they react to broccoli when they never reacted to broccoli before. And so what that says to me is actually there's something going on more, just like with gut permeability, for example, where just metabolites are actually getting the bloodstream now, something else that's triggering the body. And so, yeah, so I just find that like kind of really finding out those issues and then actually healing up the GI tract, the gut, is really key for that.
Okay, great. Do you use quercetin or any of those kinds of products too, or?
Yeah, absolutely. I do, and I find those to be really helpful.
Cool. Yeah, thank you. Yeah, I often like to think about anxiety too, and I'll talk about that with patients sort of like that as well, to structure it at different levels. And so thinking of the neocortical level, the limbic level, and the brainstem level of the sort of three ways of, or the three levels that our body is always operating at all at the same time together to create an appropriate response, right? So anxiety is actually a complex response that involves a scenario that's very neocortical, an emotion that's very limbic, and body posturing and breathing patterns that are very brainstem. And so I try to target sort of interventions at each of the levels to disrupt the circuit, so to speak. And I think that's one of the ways I think acupuncture can also work really well, is to disrupt the postures and the structures. It's like you were saying, Jody, like to do the shaking or to do the movement, it disrupts the posture you should be in when you're tense, because you're anxious, you do this, right? If you're doing this, your brain's like, well, I guess we're not anxious because we're doing this. Like, I don't even know what that is. And it just sort of confuses the nervous system in a good way and in an intentional way. So I also just want to throw that out. I want to say too, there was a comment on probiotics, which I think is a good one. There's a lot of bad products out there and meaningless products, and then there's some really good ones. And right, we want to be cautious with product endorsements and things because it's not usually appropriate in this context. But what I look for generally with probiotics is that there's about 40 to 60 billion count per dose in 6 or more strains is my overarching kind of recommendation, and then assuring that the product's been handled properly by buying through a reputable source, not just pulling it off the shelf of a drugstore or Amazon. I'm wondering, especially Colin, do you have parameters like that you could share, or are there any strains of bacteria that you feel like, you mentioned lactobacillus and bifido species? Oh, and you're muted.
Yeah, I do. Actually, I have like 8 different varieties and growing that I use. But I like to use the HMF variety, like that are actually sourced from humans. I always say, I know it sounds kind of gross and scary, but that to me, after a little bit of trial and error, I find to be the most effective. And yeah, so most of the strains have different combination, or most of the combinations are different. Bifidobacterium, lactobacillus, animalis, fragilis, and I run GI Map by which is a lab by I guess I can say they're from Diagnostic Solutions, because I just think it's fantastic, and because it gives us a nice, it's a stool analysis that lets us know, actually we can see what bacteria is actually high or low, and also there's some fungi and virus information as well. So that's really helpful. So what I do is I just see, hey, if this is low, we might supplement that. But what I always think is really important, even more than just what we supplement, it's thinking about the idea of that quorum sensing. So in other words, if we give the input, we should get to a point where the microbiome balances itself. And so I'm always really, there was a question I'm trying to answer him online, but about like how long or what's the dosage. And to me, that really, that's the goal, is to get the microbiome just to click into gear and balance itself, and then we're good. So yeah, I guess it just depends really on the lab, to be honest with you, of what I choose. Yeah.
Great. Yeah. Do you use any hypnosis style techniques? I'm just curious, in your practice, or
I trained in hypnotherapy, but I used to, but I really prefer the EMDR, and I find I kind of use some of the hypno techniques to like get people into the moment, and but I like the freedom of EMDR because I can just do it I can start it right here and right now. I don't have to
can you say a little bit more,
get
like say
people
what
in and get
EMDR
people
is?
out, huh?
Can you say a little bit more about expand the EMDR, what that is, and just explain to people if they don't know what EMDR
Yeah,
is?
so eye movement desensitization reprocessing, which just sounds like a big weighty word, and it doesn't even involve, but originally when it was developed, it involved sort of the idea that when your eyes moved like this bilaterally, that it somehow shifted like traumas. But what they've sort of found is anything bilateral, so it could be sound, it can be touch. But it's that idea of getting the information, because in trauma it gets stuck, right? It seems to get stuck on the right side of the brain, which doesn't have any words, and it's just frozen in time, right? It's ever present. And so by tapping, you're kind of crossing and getting the information into a narrative into the left side of the brain, so that it understands like, oh yeah, I'm responding like this. Like it's not about what's going on right now, right? There's a sense of an awareness that there is no that there is no trauma right here, but our body's responding as if there is. So it just kind of helps to integrate those pieces, and then I use resources in that experience, right, to help kind of shift how the nervous system is carrying it forward. Does that
Great,
make
thank
sense?
you. Yeah, it does. Thank you. That's great. I wanted to look over at sort of the Q&A too, and there's a question about sort of any suggestions for chronic pain. And I think we want to keep our focus on anxiety, but to the degree that chronic pain causes anxiety too. I think one thing about pain in general that's always a useful way to think about it is that the more you focus on pain, the louder it gets.
Yeah.
And the mood that you're in changes very much how you interpret the pain signal. So chemicals like oxytocin tend to make us less bothered by pain. Pain becomes pleasure in some cases. Pain becomes irrelevant in some cases. And so anything you can do for distraction often helps to decrease the volume of the pain. Anything you can do to improve someone's mood, and change their emotions. And so I think, Jody, you talked about a number of techniques for sort of boosting oxytocin. And I think that would kind of fit into that. There's also a question, do you use Purble with kids? But I don't know what that is. I don't know. Do you guys know what that? Sorry, Bettina, I'm not sure what.
What is?
It's called it says PURRBLE. I don't know if it's a cat related thing too, like a tool. But anyway, so sorry, I'm sure we know. And so yeah, Helen asked, is it possible that pediatricians could simply check for vitamin D, B vitamins, do a diet check before we get to complicated problems? I mean, I would think so. I don't know, Colin, do you want to comment on that? Or is that a naturopath? Like, you're on mute again.
I apologize. I was typing a question. I missed the question.
Oh, okay. Yeah. Oh yeah. So if we started with checking like vitamin D, B vitamins,
Oh, yeah.
diet and those things, how do
Oh,
you
no, I
integrate that
appreciate
into your, where do you start?
Yeah, I appreciate that. I did want to answer that question. Thank you. Because actually something I'm finding, and again, we have to be careful with generalizations, but lately I'm finding so much with the children that come in to see me for pandas is they're all low on iron and vitamin D.
Mhm.
And so I've tried to have my theories for that right now. For example, when we have an infection, especially chronic infection, the body holds on to iron. There's actually a name for anemia of chronic disease, which is kind of an intense name. But basically, in general, iron is used by bacteria and different microbial organisms to survive as well. So our body basically says, well, hey, we don't want you to survive. We're going to hang on to this. But then, of course, what it does is that our own body doesn't have it as much. And then vitamin D is super important for so many things in the body. It's actually a hormone. So we call it vitamin D. It sounds like a letter, but extremely important. Goes right to the nucleus and does a lot of work with the genes. So it's highly involved in immune cells. So yeah, I definitely look at nutritional stuff first and think about that. And oftentimes I make sure I give my pediatric patients actually a multivitamin just to make sure, because I try to take the stress off of parents anyways. Their hands are full already. They may have lots of kids. And to just try to tell them like, make it harder for them, I just give them a multivitamin, make it easy. So yeah, I definitely, and that's really important in some of the protocols that I've learned too for things like working with pediatric and like Lyme disease and so forth. So I've now used that for most of my kids. Yeah, I call them my kids.
So
Great.
at this juncture, Jacob, can I ask you to just kind of, I think you indicated you've been going through the Q&A and also the chat. Are there other questions and comments that you can read to us that haven't been addressed yet?
I think that David's getting kind of targeting through most of them. I've seen a few
Okay.
others pop up here. There's a question, I think it looks like Colin's answering right now about how long to remove offending foods. And he'll type that answer out, and I imagine he'll speak to that as well. I think we've captured the bulk of them. Just going back to the chat again.
Question about supplements too. Shervin was noting good luck with L-theanine and lavender and some of those kinds of things. Do you guys have favorite go-tos?
Go ahead.
Yeah. I mean, I'll use sometimes like quercetin again. Like if I think there's a histamine issue, or products that have a multi-pronged approach to histamine management naturally, that can be one strategy there too. I do Chinese herbal medicine as well, and so there's sort of a complex number of formulas. Like one of the most famous ones is called Free and Easy Wanderer. Shayo-san is one of the formulas that is probably one of the most widely used herbal formulas in the world. That is sort of a very gentle, very balanced anxiety and stress management formula that's often used when people feel kind of blocked and irritable, but they may have a little bit of deficiency in them too, where their digestion's not quite as strong, or if anxiety is hitting their gut, that formula, meaning they get anxious and they have a gut response with a diarrhea particularly, that's a really fantastic formula as a starting point. It's real safe and balanced.
Go
I
ahead.
think there is this one question that hasn't been addressed from Caitlin. She said that she's heard that sometimes long-term use of pre and probiotic supplements can contribute to brain fog versus getting these from fermented foods. What are your thoughts on this? Have you seen this in practice?
Yeah, I guess I'll take that since I talked about it, but I talked about probiotics. Yeah, basically I did write in the chat that I am really careful first off with prebiotics, just personally. I know they're really popular and that's great. But because I work with SIBO as well, which is small intestinal bowel overgrowth. And so basically, if we have any of that type of situation going on, prebiotics actually can feed that. And so we'll get more bloating, more discomfort, gas, and so forth. So I definitely make sure that's not an issue. But in general, so for me, I actually just like to use like whole foods for fiber, because that's what prebiotics are, right? They're just basically fiber. And the food, the cellulose that we can't digest is what our microbiome needs. I didn't even have time to talk about that. I apologize. And then, yeah, in terms of long-term use of anything personally, that's just not, I try not to do that ever. I always try to say any supplements I give is very targeted. We don't want you to have to take this your whole life. This is just for right now for what you need. So that goes for probiotics as well. I have not seen brain fog and stuff like that from long-term use. But I'm sure it could happen. I think that all kinds of, I think also it's the quality of the probiotics, to be honest with you too. I'm really, I try to use the highest quality and because of the issues, like you said, if you get stuff off Amazon or something, it's not always gonna work the best, so.
I think we can tie onto that question. There was an additional one about SIBO and how that might relate to anxiety, kind of the abnormal deposition of probiotics.
Yeah, I don't know if you guys want me to speak on that, but all I can say is definitely anxiety is often accompanied with SIBO. It's just that feeling of bloating, the feeling of burping and farting and all these inappropriate things that people get embarrassed about. And then of course some of the other issues that can tie in, like high histamine and gut permeability. Yeah, absolutely, it's anxiety is an issue.
I would throw in there too that I often see, like with gut, that's that bidirectional axis, the way the body and the mind communicate with one another, that oftentimes when people are anxious, their stomachs get upset, but then when their stomachs get upset, they think they're anxious because it feels the same. And so sometimes you have to kind of help people determine what's coming from the brain and what's coming from the body. Is it a bottom up problem or is it a top down problem? So they may have reflex from a food, it's giving them upset, it's making them feel anxious because they think they're anxious, or they're getting heart palpitations. But in reality, right, it's a very physical issue, and then it just is getting misinterpreted as well. So throw that out there as a piece. So I wanted to I saw Diane had a really nice comment to make too, Dan. Was mentioning that affordability is often a problem. So which it is, that's often a big thing. Certainly with supplements, we run into that all the time, and trying to source things that are the most economically priced, that are still worth buying and meaningful. Trying to get people to eat whole foods, largely plant-based diets can be very challenging as well. But I think, for where I am, one of the things I love about being at UH is that I can take all insurance. So I, public aid to private insurance, we're pretty much covered. So that's feels very much like a luxury that I did not have in private practice. But I don't know what your guys' setups are right now for your practices, and what you would comment on that.
Yeah.
Jody, do you do, what's your,
I mean, are we talking as far as supplements and stuff?
well, or just general accessibility to even like your services and things like that? So
So I mean, I am fee for service, so it is hard. I'm trying to figure out ways around that, but that hasn't happened yet. I'm considering some kind of app where people can just reach me for it minimally, like in certain
yeah,
at sort of a scale, so that it would be more affordable in
accessible.
some way. So that, and as far as supplements, I kind of keep a list of like good ones that you can find on Amazon. A lot of the stuff that actually are on Full Script, I probably shouldn't say that on here, but they're also on Amazon and they're cheaper. And so I kind of keep a list and try to direct people to where it's cheapest. And sometimes it's cheapest on Full Script and the other places. It just depends.
Exactly. Fair enough.
And I would just make a plug here for naturopathic doctors in the state of Ohio. We are working towards licensure. So right now we are not covered by insurance, but if we get great public support and our representatives pass the bill that we are actually Dr. Wolf is spearheading here with the OHNDA, that we will have more likelihood to be covered by insurance like other states.
That would be great. That is so needed, and it is such a an access inequality and social justice kind of component of everything, to have that kind of access. So yeah, kudos to that work, and the political meets the practical. So
Okay, I just want to say that there's been so many questions about, I missed some of the presentation and about the slides and stuff. Just to say again, everything has been recorded and it will be available on the YouTube AIHM channel. And we'll send a note out to everybody who's registered tonight about when that is available. And I think, David, you were going to share your slides. Is everybody else willing to do that as well?
Mm-hmm.
I mean, no pressure if you don't want to. But yeah, so if everybody,
will you just send those out, Peter, via the list of registrants or something, or?
Yeah, so when the video is available, I will also send out a link to slides for those of you who give us a link to the slides. You know, if you provide one, we'll send it out with the same email. Is that okay? I don't want to. I don't want to coerce anybody into doing that if you don't want to. But anyway, that's so that I hope that answers everybody's concerns and questions about, you know, availability of what we had tonight. I just want to thank everybody again. This is just absolutely fantastic. Great discussion, great individual presentations. So far reaching. Again, I wish we had time to dive more deeply into everything, but you know, as you pointed out, David, a couple of weeks ago when we met, these could be jumping off points for individual presentations, you know, for other meetings. So again, everybody who is not a member of our mailing list, please subscribe if you want to find out about these kinds of events. And again, next month we're having the networking event, and we'll tell you more about that in February. And March, Dr. Paul Anderson on common pillars of improved cancer outcomes. So thank you all so much for participating and for attending. And good night. Have a good night.
Thank you so much.
Thanks, everybody. Thanks.
Take it.